Welcome back to O.M.A Medical Studio. This is part 3 of the headaches you've been doing. We've been able to speak about secondary headaches. We've been able to speak about a little bit on um, primary headaches. Specifically, our recent video was on migraine, and we've been able to discuss migraine. So when you go to our YouTube page, you will find the video there. Alright, so we are coming to the most common type of, or the most common form of primary headache, which is what tension headache. I think when we are done with this one, we will basically move to the last one, which is the very less common, but one of the most difficult ones to see. Alright, so this video, for the purpose of this particular discussion, we are looking at what tension headache. I mean, the name speaks for itself. You understand? If you want to know what tension headache is, just look at the name, look at the topic, tension. And we said headache occurs what basically triggers the triggers of headache basically affects the brain. So whenever the brain in any way is affected, the vessels get stimulated, it get agitated, they get distracted, then basically um we are going to suffer from what you call what headache, either primary or secondary. So tension headache is one of the primary headaches we have, and then out of that, it is the most common one may experience. Even though more often tension headache is what confused with migraine. Today we are going to get to know some of the reasons why they get confused with what migraine. All right. When it comes to tension headache, it's just telling you that there is so much tension around the brain. So anything that is going to put tension around the brain is going to give you what tension headache is. Like we have said earlier on, primary headaches have no true defined cause. So basically, the tension around the brain is going to come from a lot of things, a lot of factors that is not going to directly affect the brain structure or the tissues of the brain, but basically the activities of the brain, the physiologic activities of the brain is going to get distracted, and around it there is going to be too much tension, and then you may not be able to deal with it. It may lead you to a hospital, and then medication might be what started. All right, so these are the various triggers of what tension headache. Various triggers that will basically put tension around the brain. I mean, I've tried so much, and I've put in this one in a mnemonic form. I don't know how simple it is, but then maybe you'll be able to get it. All right, so if basically you want to know the triggers of tension headache, this is how you need to keep this mnemonic. Eyes might pain, so stop smoking and sleep well. Your eyes might pain you, so stop smoking and sleep well. I hope this is a very simple mnemonic. I hope I did my best. So please give me my flowers, right? Alright, so eyes, what's the trigger? When you strain your eyes so well, you put so much tension on the brain, especially you stay awake all night, looking at your laptop all night, trying to, I don't know what you are trying to learn, you understand? We or some of us or some of you guys do that. When you put so much tension on the brain, one of the things that basically will lead you to that point is what eye strain. So when you strain your eyes too much, you may likely suffer from tension headache. Also, when there is frequent migraine attacks, like I said, there was a point in migraine discussion where I said 15 episodes of migraine in a month. Basically, that is what chronic migraine. More than 15 episodes of migraine in a more than 15 episodes of migraine in a month, you are talking about chronic migraine. Less than 15 episodes or up to 15 episodes, you are talking about episodic what migraine. So when you have frequent attacks of migraine, basically there can be a lot of tension on the brain because it's being stressed out. Understand? Then you look at posture. Poor posture can also give you a lot of tension on the brain. Poor posture can give you a lot of tension on the brain. Then we come to so stop smoking and sleep well. So stop smoking and sleep well. So your eyes might pain, so stop smoking and sleep well. Eye strain, frequent migraine attacks, poor posture, sinus infections, sinus infections, sinusitis, sinus infections. there are holes within the cavity, the brain cavity where vessels and neuronal signals passes. So if out of those I'm saying holes basically because I want you guys to understand, out of any of those holes there is some kind of infections there, they can put a lot of stress on the brain, and then you are likely to suffer from tension headache. Now note that the tension in the brain is not directly um, from the infections, but then it's the infection is putting an indirect pressure on the brain and also tension on the brain. So basically, you're going to suffer from what primary one of the primary headaches. Now the reason I'm saying this is basically when we spoke about the secondary headache, we spoke about the fact that infections can cause it, and one of them was sinusitis. That is basically going to give you the rhinorrheas and all those stuff. So basically, you are going to you might think that the fact that there is sinus infection as a trigger to tension headache means that tension headache should be a secondary what headache. Some of the triggers can mimic secondary headache what um some of the triggers can may lead to symptoms that will likely make you think that it is what a secondary headache. But that is basically what a tension headache, putting a lot of tension on the brain. Then you need to what stop smoking. I mean, the smoking here, was what do we need to stop smoking? So I think I I might pain you, so stop smoking and then sleep well. So you need to stop smoking, you need to sleep well. So stop smoking. So smoking can also what, lead to that. Then we have what? Lack of adequate sleep. Lack of adequate sleep can lead to that. Now the reason why I passed this is that almost all the things we've spoken about, the triggers here, is basically leading to some kind of stress on the brain. So eye strain might lead to stress on the will definitely stress the brain. That's put tension on it. Frequent migraine attacks will stress the brain. Poor posture will stress the brain. Sinus infections will stress the brain. Smoking will stress the brain. Lack of adequate sleep will also stress the brain. So the stop here means stress. That's basically why I had to pass it and then come and do it last. Understand? So stress on the brain, specifically emotional stress, especially people who have been through broken hearts, and then basically they are trying to cover, they can't get over that particular partner of theirs, and then they are stressing themselves to understand the situation, to understand the event that has taken place. They can't get the head and tail of the event. How did it happen? Understand? They stress themselves to the point where they suffer from this particular headache. It's very very severe. You understand? Yes. So these are the triggers. So let's take note. Eye my pain, so stop smoking. Eye strain, frequent migraine attacks, poor posture, sinus infection, stress, emotional stress, specifically smoking, and what, lack of adequate sleep. Understand? Now, I said that most of the time it might be confused with migraine. You see, the triggers are similar to migraine triggers. All right, we will get there. How do this one, or how does it present? When you have tension headache, I said what? Let's take this is the head, this is the body. I've been able to draw very well. This is the best drawing I could come out, the best drawing of the human being I could come out with. So just keep it like that. So this is the head, this is the hands, these are the legs, you understand? This is the neck. So at the end of the day, he said that tension headache is basically means that there is a lot of tension around the brain. So when there is a lot of tension around the brain, physically, you're going to have pain. I mean, come to the definition of headache, pain in the head. You're going to have very much pain in the head. Now, when there is pain in the head, this with this particular type of headache, the pain is going to spread up to the neck level. When it gets to the neck level, so there is pain in the head, there is pain at the neck level, they come. I've been suffering from this kind of headache, and it comes to my neck, it holds my neck, and I can't even do anything. I can't even turn. Then there's what you call, I mean, these are for the people who are health inclined. Tenderness in the forehead and the scalp. Once you press the forehead, you try to beat the forehead, they will try to elicit pain. It's very irritating to them. They feel pain and they tell you, or sometimes you try to reject it. That alone should tell you that you are irritated by what the way you beat that side. Alright, so tenderness what in the forehead and the scalp. So you are going to have pain around the head, you are going to have pain spreading to the neck level, then you are going to have pain when you beat the forehead, and the what pain and the what scalp when you what beat it. So this is how tension headache presents. So when you hear anything like I'm having pain, that is I'm having pain that is basically coming to my neck, and then basically when you do this, when you beat the forehead, there is tenderness or there is patient eliciting pain, then you can at least make conclusions on that. All right, let's come to some of these things. I earlier spoke about the fact that we can confuse migraine with tension headache. Let's look at the similarities. One of the similarities is basically their triggers: stress, um, some medications we take, and then lack of adequate sleep. All of these things amount to what? Stress. So these are some of the similarities. And another key similarity is the fact that someone with tension headache may also suffer from photosensitivity and what? Light photosensitivity, or basically sound um, sensitivity. But in these tension headaches, this particular photosensitivity and light sensitivity basically doesn't occur frequently. It's very rare. So unlike the migraine where it is very frequent, it's almost always likely that the person is going to suffer from this photosensitivity and noise and sensitivity. But with tension headache, it's very rare. But then when they come, when a tension, someone suffering from a tension headache comes with that, don't be surprised. It can occur. You understand? So those are some of the similarities. And when we come to the differences are that in as much as migraine will come with tension headache might come with photosensitivity, light sensitivity, and those things. Whatever happens is likely not to give you nausea and vomiting. That's tension headache for you. Whatever happens is likely not to give you nausea and what? Vomiting. Those are some of the differences and similarities. All right, how do we manage it? So someone comes to you with pain around the head, pain around the scalp, or pain in the scalp, pain in the head that gets to the neck level. The person is a chronic smoker, or probably, yeah, not that the person smokes too much, but then the person has been smoking frequent days, and then maybe there can be history of sinus infections or anything, or probably the person stays awake all the time trying to learn something. You know that there are triggers, there are a lot of risk factors here. So basically, your likely diagnosis is going to be what? Tension headache, due to the presentation of the type of headache. Even though you might mistaken it, or you might confuse it with what? Migraine. So that is how tension headache do. Okay, I mean, this is very simple here. Then we get to the management. Like I'm saying, these are painkillers. This is pain management. So I don't specifically want to mention the specific drugs to it, because people might abuse them. So yes, these are for the health inclined people. So in so doing, I've tried to write it as small as I can so that you guys do not see. Unless you zoom, when you zoom to it, will become blurred, so you won't see it well. Just clap for me. All right. So we have, I mean, to deal with anything, just prevent the triggers. Those are the very basic form of management. To deal with a particular condition, prevent the triggers. Try to stay away from the triggers. And we've spoken about the triggers here. So try to have adequate sleep. Try to take in adequate water. Hydrate yourself very well so that you don't put too much tension on the brain. Eat well, and then if all of these things do not take care of it or do not improve your symptoms, you can go for medications. Going for medication means that going to a very qualified pharmaceutical shop to explain your symptoms to them, or basically get to a nearby clinic or hospital to explain your symptoms to your physician. So we have the use of antidepressants, beta blockers, NSAIDs. There's a particular medication those days we used to call it akokwabebobo. I mean, this time it's still there, but then we are enlightened, so we don't say akokwabebobo again. Yes, it's part of it, endemic acid. So it's part of it. So yeah, that's it for tension headache. Stay tuned. We come with the last one, which is the less common one, but one of the most difficult ones to also do. And that is what cluster headache. So we will come there. Just stay tuned. And if you haven't subscribed, try to do so. Share the link for others to what get access to this as well. Thank you.